My name is Marianne Matheson, and I work for MedTronic in their marketing division. Tonight, I have the pleasure of introducing Nicole. She is going to be speaking on overactive bladder, urinary retention, and fecal incontinence, also known as stool leakage or bowel leakage, as well as a therapy called InterStim that helps to treat those conditions. Nicole has been in urology for 2.5 years. Prior to that, she was in oncology for 4 years. So she has a ton of experience dealing with these things. She sees this condition daily and deals with this disease state a lot. So I think we're really going to learn a lot from her and have, a wonderful time. And please feel free to ask questions throughout the presentation. One more thing that I do want to note is we'll probably answer the majority of those at the end, just to make sure we don't lose train of thought or anything like that. But there's a Q&A box in the bottom of your screen. So please type all of your questions there. For HIPAA purposes, we're not going to be able to unmute anyone. So if you raise your hand, unfortunately, we're not going to be able to let you talk, but all questions in the Q&A box. A couple of more notes. As mentioned, I work for MedTronic, and that's the company that helped develop this therapy. So while you may not know the name MedTronic, you probably do know someone who's had a pacemaker, and that's what we're best known for. So without further ado, I'm going to go ahead and pass the mic to Nicole so that you can hear more about these conditions. But before I do, a couple more reminders. Everyone has been muted upon entry. If you have any questions, like I said, please feel free to type them in the question and answer box. All of your names will remain anonymous, and we're going to answer those questions at the very end of the presentation. And likewise, there's an anonymous survey that will pop up at the end on your screen. So please remember to answer that. So now I'm going to go ahead and pass the mic to Nicole.
Thank you, Marianne. Good evening, everybody. Hopefully everyone can see the screen and can see us okay, or see me okay. We're going to go ahead and get into this slideshow. And like Marianne said, just save your questions for the end. If you have any and you're afraid you'll forget, just go ahead and write those down. We'll start off with this first slide. This one, basically, many of you might be having thoughts or concerns or being overwhelmed with some sort of bladder issues or maybe even fecal incontinence. This can be a really embarrassing thing that we don't want to talk about. We don't want to talk about it to our family, our friends, sometimes even our healthcare providers. A lot of healthcare providers won't even ask about it because it's just a sensitive topic. So we're here to help you change that if you are having these issues and give you some options for relief. We're here to tell you a life without limits is possible, and we're here to teach you how. First, this is our agenda for this evening. We're going to be talking about understanding bladder control, how the bladder works, some problems that can occur. The care pathway shows the possible progression of treatment. We're going to go over some treatment options that will help control those symptoms for you. We'll discuss MedTronic bladder control therapy. We will also then have a question and answer session afterwards. So this slide just kind of gives you some statistics. This just lets you know that you are definitely not alone in this if this is something you suffer from. As the slide says, 1 in 6 adults has overactive bladder, or we'll refer to it as OAB. 1 in 12 has fecal incontinence, which we will refer to as FI. These are more prevalent than vision and asthma combined, as you can see by the statistics here, but we just don't talk about it very much. Many people don't want to talk about it. They're wearing pads, they're restricting social activities. If you feel like you can't go to family functions, you can't go to the store, this might be you. We've got some options for you for help with this. We just never really talk about it like we do vision problems or asthma or the traditional, medical issues that we have. So this slide here kind of goes over what's normal, what isn't. Most people will think, oh, I've gotten older. It's part of the aging process. I'm going to have some issues with bladder or bowel incontinence. That's not true at all. This can actually be dealt with easily. Bottom line is these are embarrassing. We don't like talking about it. We don't like bringing it up. If it does prevent you from doing your normal activities, going out, enjoying family and friends, then this might be you. This just shows the bladder control pathway. So basically it's your bladder sends signals to your brain then, your bladder becomes full, then sends signals to your brain, which tells your bladder, hey, it's time to go to the restroom. We feel that urge, we feel that squeeze. Sometimes if we have any type of incontinence, we might feel some leakage and we run to the bathroom to go. This just shows us kind of that pathway. Just remember this for further on down the slide so you can understand how these different treatments work. Okay, this slide is showing the digestive system because, like I said, we're going to talk about overactive bladder as well as fecal incontinence. This shows how the brain communicates with the bowels, pushing your food through your digestive system. This usually takes 24 to 72 hours from the time you've eaten. Muscle contractions will squeeze the food through different sections. Each section is separated by bands of muscles or sphincters, which act like valves, allowing the stool to move through the colon. Keep that in mind again as we go through and we talk more about fecal incontinence in a few slides. Okay, so some people often wonder, why me? Why do I have incontinence? What causes this? There's a lot of potential causes. Some are as simple as everything we eat or drink, or different behaviors that we have. Some are related to different life events, such as childbirth or pelvic floor injury, radiation. If you've had any type of injury to your pelvic floor or surgical complications, that can also be an underlying cause of these issues. These are the three most common bladder control problems that we'll touch on. First one being stress incontinence, second one being urinary retention, and then we'll talk about OAB or overactive bladder. Stress incontinence is that familiar sneeze, cough, laugh, leak a little bit of urine, or maybe leak a lot of urine. A lot of times this can happen, especially after, for females after they've had multiple births, vaginal births. It's typically due to weakened or damaged pelvic floor muscles, like we discussed in a few slides previously. Most of the time, stress incontinence will require some form of surgical correction if it is severe. Urinary retention is when you can't empty your bladder completely, or you're unable to empty your bladder at all. That can be really frustrating. It can lead to needing to use a catheter daily in order to empty your bladder, or have a catheter that stays in your bladder to keep it emptied, because this can ultimately damage your kidneys if you're not able to empty your bladder for extended periods of time. Overactive bladder. This can be defined in a couple ways. Urge incontinence is the sudden urge to go to the bathroom, or inability to reach the restroom in time, even though you feel that pinch that, hey, I have to go urinate, and you just can't get there in the amount of time you need to. Frequency refers to how many times a day or how many times a night you have to go to the restroom. If you have true OAB, you may have a kind of a variety of these symptoms. It doesn't have to be one or the other. It could be a mixture of them. And it's our job to help you find something to help you improve these symptoms and get a better quality of life. This is the slide on fecal incontinence, or FI. This one we really don't speak about much because people are traditionally embarrassed by this. Bowel incontinence can happen when we have maybe an upset stomach and we end up with some form of diarrhea. What fecal incontinence refers to is recurrence of these situations. It doesn't always have to be related to diarrhea. It's a recurrence of leaking stool, or feeling the urge to go and not being able to reach the restroom in time. These can be complicated by other issues: constipation, gas, bloating, diarrhea. But there are ways to deal with this. You don't have to live with this issue and be embarrassed by it. Good news, like I just said, we have some treatment options for both OAB and FI. So treatment pathways for OAB and FI are very similar. There's a number of steps involved in finding the best treatment that's suited for you. Conservative treatments are shown on the left of this slide, being lifestyle and dietary changes. Advanced therapies on the right, with medications and more advanced therapies. We're going to touch on each one. Lifestyle and dietary changes. This can be something as simple as decreasing your caffeine intake, adjusting your fiber intake, or getting more exercise. Pelvic floor strengthening is important, particularly when it comes to things like stress incontinence and urge incontinence. Bladder or bowel retraining. such as delaying going to the bathroom or sticking to a schedule, or what we call timed voiding, where you're going to the restroom every 2 hours. For fecal incontinence, it might involve physical therapy, which is exercises to strengthen the pelvic floor muscles and the sphincters. These are things that can be done on your own, can be done through pelvic floor physical therapy programs. They don't always work 100%. So we'll discuss some other options if these things are not fixing your symptoms the way you want them to. Oral medications. There are a multitude of medications out there. There's different classifications of them. The major group of medications that most people will use for OAB is going to be anticholinergics. It's just a big, long, fancy name that you don't have to know. But with these medications come a lot of side effects. So some of these side effects being dry mouth, constipation. Some medications have hypertension as a side effect. There are also some studies shown that in our population over the age of 70, some of these medications can cause exacerbation of dementia or Alzheimer's and some continued memory loss. So, they come with side effects and they don't always work for everybody. Treatments aren't one size fits all, so we kind of have to tailor it to you specifically. Advanced therapies. This is where the InterStim system comes in. This works well if conservative therapies haven't worked for you. We've got InterStim works for bladder as well as bowel control. And then there's injected medications also for bladder control. Botox is the injected medication I was talking about that is injected into the bladder to help with overactive bladder. So this focuses on the muscles of the bladder, not the nerves. Remember back when we saw a few slides back, we saw the pathway. Your bladder control is muscular because your bladder is a muscle, but then there's also nerves that are sending signals to your brain. So Botox goes in and basically paralyzes those muscles in the bladder, giving you more control and, not leaking the urine. Some side effects of these, sometimes you can end up with some urinary retention, which requires you to cath yourself. These treatments also require you to have them done repeatedly. It's not a lifetime fix. This is something that you would have to get done routinely, which is probably why most, a lot of people, like it says here, on 51% of patients will stop after 2 treatments because it is a repetitive thing. The MedTronic system. So again, big, long, fancy word. Sacral neuromodulation, MedTronic InterStim systems. I will just refer to it as InterStim because that's easier. This therapy provides relief and restores bladder function by gently stimulating the sacral nerves. So when we talked before about muscle versus nerves, this one is aiming at the nerves to help control that bladder. They use gentle nerve stimulation to correct the bladder-brain communication pathway and restore bladder function. The test. So first with an InterStim, the great thing is you're not put under any type of surgery unnecessarily. There's a test done. You basically get to take it for a dry run, a test drive, as I call it. It lets you try the therapy before you use it. And I think it's wonderful because you keep basically a log for a week and then you get to come in and let us know if it worked or if it didn't for you. So you're not tied to anything. You wear it for about a week and then you come in and you let us know, yes, it worked, it didn't work. So for fecal incontinence or FI, about 89% of people you can see on this slide experience long-term success, which is great. So that's 9 out of 10 people. For bladder control, 76% is what we're seeing in studies. I'll say clinically, I usually tell people 9 out of every 10 tests that I get back will proceed with a permanent implantation because they had greater than 50% improvement. It's been used for bladder control since 1997, so this isn't a brand new treatment. Let's see, next slide. So what makes someone a good candidate for this therapy? Well, if you have symptoms of overactive bladder, like urge incontinence and urgency frequency, or if you have non-obstructive retention, like we talked about before, the inability to empty your bladder, or if you've tried several things, lifestyle modification, oral medications, and none of these have worked for you, then this treatment would definitely be an option for you to try. These are just a couple slides of some patient testimonials, people who basically have tried other modalities and then went to the InterStim and had good results. You'll get these in your email. You'll be able to have a testimonial video that you can watch. But I can tell you from patients that I've seen, I've had many patients tell me I didn't go to the store, I didn't go to family gatherings because I was afraid I wasn't going to know where the bathroom was. Or as soon as I enter Walmart, I look for where's the restroom because I know I'm going to need it twice while I'm in here grocery shopping. And these people come back after having good results with the InterStim, and they are able to go live freely. So next steps for you guys is going to be contact our office. We can schedule an appointment. We can do a one-on-one talk about what modality of treatment will be best for you. Because this, like I said, this isn't a one size fits all. One thing that works for one person won't necessarily work for the next. And then right now we're going to open it up for some questions. So if you guys have any questions, go ahead and type those in the question box and we'll go ahead and answer those. This slide gives us just kind of a few of the more common questions that people will ask, or things that might be on your mind that you just want an answer to. Relief, how long does the relief last? The studies have shown effectiveness out to 5 years, but like we said, everybody's a little bit different. Will it cure my condition? I tell everybody I aim for a 50% improvement. So if you come to me and tell me I'm waking 6 times a night to urinate and we try everything and nothing works, and we try an InterStim and you come back and you tell me I'm only waking twice a night now, then that to me is a home run because we've improved you 50% or more. And then you guys can read over those other questions. One main one that comes up a lot for people is, can I have an MRI? And yes, this device is MRI compatible. You can have a full body MRI scan, so it does not limit you when it comes to any other procedures you might have to have done.
Excellent. So Nicole, we did have some questions that came in.
Okay.
So how long should a patient try a medication before deciding if it's a good fit for them?
So generally we will put you on a 30-day run of a medication to see if this is going to give you the benefit that you desire before we move on to a different treatment option.
Okay. And the next question that came through is, how many medications should I try before moving on to an advanced therapy?
Typically, you only have to try one. And like we talked about before, depending on what age range you fall into and what different comorbidities or other disease process you might have, some medications might not even be an option. So we typically just have you try one.
Okay. Another question that we had come through is, OAB just something that happens when you get older, and should I just deal with it?
No, no, and no. No. So OAB can happen to anyone of any age. I have people as young as 20 years old who have tried medication, who have tried InterStim, who have done different things to help with their symptoms. And then I have people as old as 92 years old that have an InterStim device. So this is not an age specific issue.
And another question that came through is, do your patients see a big improvement with their quality of life when they get InterStim?
Yes. So yes, like I said, I venture to say just my own take on things. And I know, 76%, that's probably a nationwide stat kind of study that we have, saying 76% of people will have relief from a urinary standpoint, but I see about 90% people, and they do have significant improvement as far as what they feel comfortable doing. If they're wearing pads or, adult undergarments to help with their leakage, they get to come out of that, and they see a lot of improvement and less embarrassment afterwards.
And what would you say the recovery is like with the InterStim therapy?
So after the surgery, the test itself, there's no, I don't want to say there's no real recovery because there's no surgical procedure, but after the actual full implantation, if you do proceed with the full implantation of the device, the recovery is very quick. It doesn't really limit you from doing anything other than really the day of surgery. You can go about your normal business, and just listen to your body because you do have a little incision, and that incision has to heal, but there's really not much downtime.
Okay. And then can you kind of discuss like the difference again between stress incontinence and urge incontinence?
Sure. So stress incontinence is more related to weakened pelvic floor muscles. That's the one that we talked about was I laugh, cough, sneeze, I leak urine. I've heard I can't jump on a trampoline with my kids. I can't do jumping jacks at the gym because I'll leak urine. That's more of a stress incontinence. It was urge incontinence was the other
Yes.
one. So
Yeah.
urge incontinence is more, I feel the urge to go, and on my way to the restroom, I start leaking urine because I can't hold on to it.
Thank you.
Yeah.
And another question that came through for the InterStim was how long does the implant or battery last?
So the battery life right now, and correct me if I'm wrong, but I believe we're at 10 to 12 years.
So yeah, it's a 10 plus year battery on the InterStim
Yeah.
X, correct?
Yep. So a good long time, which is nice.
Yes.
Yes.
These are great questions.
These are
Thank you,
really
guys.
great questions. Yes. Keep them coming.
Look here.
So we do have a couple questions. I think those.
Oh, okay.
Yeah. So someone asked, what about over-the-counter azo bladder control? There are a lot of medications out there over the counter. I can't speak on all of them just because I don't have the package inserts in front of me, and there's so many different options. As far as over-the-counter bladder control medication, I have not seen a lot of success with my patients with anything that they've taken over the counter. It usually requires a prescription medication or more advanced therapies. Another question is, do Kegel balls help tighten pelvic floor muscles? They can, and that's something that pelvic floor physical therapy would be able to help someone with, especially if it was related to some pretty severe stress incontinence.
Excellent.
Any more questions out there?
So those are all the questions that I see at this
Yeah.
time. We're just double checking. We can give it a
They are anonymous. The questions are anonymous, so don't, we talked about how this is it's a sensitive topic for a lot of people. Nobody wants to discuss this openly because it's embarrassing. So feel free to ask your question. No one's going to know that it's you or that you're asking it. And someone else may very well have the same question and just be afraid to ask it as well.
question or a comment that I hear a lot with patients is they, like you've said in your presentation, that they think it's a normal part of aging.
Mhm.
They wait a really long time to seek treatment.
Yep.
And then I'll hear patients say things like, man, I didn't think my symptoms were that bad.
Right.
And then come to find out that it was definitely like the treatments were helping them significantly.
Right. I agree with that. I hear that all the time. I will get people, saying, well, it's just a part of getting older. This is just a part of getting older. And, I'll ask the same questions, how many times you get up at night, or are you having issues throughout the day? And well, it's just part of getting older. And I go, well, no, it's, that's a yes and no answer. Yes, we do tend to see this more as we do mature. I don't like saying old, but as we mature, but it does not mean that we can't treat it or we can't improve it. Like we talked about before, can I cure it? Probably not, but I can definitely improve it by greater than 50%, like we talked about. That's the goal. One more question that just came in: are there foods or drinks that increase urine incontinence? So there are drinks that absolutely increase frequency of urination. Coffee, tea, soda, alcohol, those all are what we call bladder offenders, and those will increase your urgency and your frequency of urination. And I know another one of the questions on the frequently asked questions is, will insurance cover the cost of the InterStim device? That's one that I get a lot too. And yes, Medicare and most private insurance companies will cover that therapy. And that's also something that we can tailor to you and discuss in a one-on-one in the office, because we can definitely look that up and get you all that information at a visit.
Yeah, again, these are great questions.
Mhm.
We'll just give it like another minute or so, see if anybody has any other questions. Like Nicole said, if you're thinking it, other people are thinking it as well. So, and this is anonymous.
Definitely. I'd say we're here all night, but we're not here all night. We're here for a little bit longer.
Yeah. Here, I had another question come through. How long does it take to get an appointment at the office?
Oh, we can get you in. We can do almost same day appointments. We can usually get people in within at least 48 hours to get in and be consulted. Yeah,
Excellent.
it doesn't take long. And if you decide, if you've already tried medication, if you've already tried behavioral modification, being dietary or timed avoiding, whatever it is that you've tried, and you say, okay, I've tried all these things and I want to try an advanced therapy, we can generally get you on for that within a week as well. It's not a long waiting period for these things.
Now, if they have seen, like if they've been treated by their primary care physician and they were prescribed a medication, they probably just need to come in like knowing what medications they've previously taken
Correct.
and for
Yeah.
how long.
Yeah, it's important to know which ones have been tried, for how long, and what kind of results, if any, and side effects, if any, that you've had off these medications. That just gives us a better understanding of what we've already been through, so we don't put you through the same thing or the same medication, and we can kind of move on and get you some relief.
Excellent. So, well, thank you so much, Nicole. I think that's answered all the questions that we have in the chat. So I just want to say thank you so much, Nicole, for hosting this event with us tonight. It was extremely informative and we are grateful for your time. And thank you everyone for joining us. Please jot down the phone number for Dr. Dorr in Nicole's office so that you can schedule an appointment. Much of what was discussed tonight is relevant to so many of you, but each and every person is unique. So it's always beneficial to make an appointment so you can discuss your symptoms one-on-one. And if you don't mind, please fill out the short anonymous survey once the event concludes. It will appear on your screen and be emailed to you. So thank you guys again so much and good night.
Thank you, everyone. Have a good night.